So BCCs and SCCs are diagnosed during the skin check. Often your skin cancer doctor will diagnose them either dermoscopically, so just by how the appearance of the skin cancer looks like, or by a biopsy. So often if they're suspicious about a lesion, they may do either a shave or a little punch biopsy of it to diagnose firstly if it is a BCC or an SCC, and whether it's an aggressive type of BCC or an SCC. That sample is then sent off to the pathologist, who looks at these lesions under a microscope and can tell us what sort of subtype of BCC and SCC that lesion is. Based on their result, we can then cut out that lesion with the appropriate margins, because the margin varies depending on what type of cancer it is. In some early cases, we can even use topical treatments or light treatments like photodynamic therapy to treat these early level superficial skin cancers. The incidence of these keratinocyte cancers varies a lot depending on the age. So usually at younger ages, so up to about 35 to 40, we'll see more likely to have melanomas and BCCs. But usually patients over 60 will see more likely to have melanomas and SCCs. So there's often a double peak with the melanomas. That peaks young and then again older. With BCCs and SCCs, the prognosis is quite good if it's caught in its early stages. Whilst they are less aggressive of a skin cancer compared to melanomas, they do still have the potential to spread if left long enough. The beauty of getting them early during a skin check is often they're cut out with just a 4mm margin and no other issues after that. But once you have one, you're more likely to have another, so it's very important to stay on top of your skin checks. When you have lots of moles, it's very hard to keep track of them all. The main thing we want to know about is change. So when you have lots of moles and you've noticed one is changing compared to all the others, we definitely want to hear about it. 70% of melanomas occur as a new mole growing out of skin, but 30% of them grow from pre-existing moles that you've always had. So even if you've had this mole your whole life or many decades, and now it suddenly starts to change shape or size or color, that's a reason to flag it up with us. Even if it means part of it is starting to go lighter, which can still be a clue of melanoma. So one of the common presentations we see are for what people call barnacles or age spots, and we call them seborrheic keratoses. These unfortunately are often growing, dark and raised lesions, which can cause a lot of concern for someone who's never seen this before, and typically grow after the age of about 40 onwards. Luckily, these are benign and very easily managed by us. Often they can even fall off on their own, or be treated with just liquid nitrogen treatment, but often don't need treatment at all.